thank everyone for taking the time to be here for this multi-agency town call to help address some of the questions and concerns that you all have regarding the new guidelines and the return of restrictions due to the rise in COVID cases to help stop the spread of this really highly contagious virus. The role of the Office of Nightlife is to be a convener, a liaison, and an advocate to bring the city agencies and the industry together and to make sure that you are receiving the guidance and information that you all need and to amplify the concerns that you have to government where the decisions are being made. And that is what we are all doing here today. Today, we are conducting this town hall a little differently than the others that you've seen. Firstly, we have a new presenter with us, Jackie Bray from Test and Trace Corps, who will be giving a presentation on the latest COVID statistics, as well as the test and trace process. As cases rise, you may be confronted with patrons and or workers who are being diagnosed. And we want to make sure that you all have the information that you need about how this process works. After her presentation, we will be going into a Q&A dedicated to the test and trace process. And then afterwards, we will be bringing in the city agencies to discuss the latest winterization guidelines that were released last week. Also, what is new during this town call that we haven't done before is that we have 2 people from each agency approximately to be able to be in the Q&A room, to be able to answer your questions in real time so that we can get to as many questions as possible, which in the past we have done follow-up emails. So we hope that this will help to address as many questions as possible. Jose Sogard, the Deputy Director of the Office of Nightlife, will still be minding the Q&A and will be bringing your questions also live into the call. We are all still very much in this, but we are making our way through it. We are continuing to press the federal government to pass the much needed economic stimulus package and also to pass the Save Our Stages and Restaurants Act. But there is light in these dark times. There is emerging news of the vaccines and improved testing, and there is reason for hope. So please know that this office is here for you to get you the answers that you need and also to amplify your real concerns and questions about everything along the way. So with that said, another thing we're doing is just having one presentation and then DOT and getting just right into it. With us today, I just will give a brief introduction to everyone you see. We have Jackie Bray, who is the Deputy Executive Director of the New York City Test and Trace Corps. We have Chelsea Cipriano from the Department of Health and Mental Hygiene. We have Judy Chang and Julie Shipper from the Department of Transportation, David Lewis and Joseph Ackroyd from the Department of Buildings, Andrew Dushinsky from the Fire Department, Christian Klossner from the Office of Special Enforcement, and Stephen Picker from the Department of Small Business Services, Food and Beverage Industry Partnership. I didn't introduce myself. My name is Ariel Palitz. I'm the Senior Executive Director for the Office of Nightlife at the Mayor's Office of Media and Entertainment. And so with that said, I pass the baton to Jackie Bray and for her presentation. Thank you.
Thank you, Ariel, and I want to thank everyone who's this afternoon to listen to what we've got to say. And I also just want to start, I have this great privilege to be a public health professional right now. And I sort of get to have blinders on, and I get to talk about what we need to do to keep everyone safe. But I want to just start with who are going through. To be a small business owner during this sort of year of COVID of 2020 with a lack of the federal aid that you need and you deserve, and with a sort of never-ending set of hits, I admire perseverance, I admire your resilience, and I also just thank you for being the type of business leaders that we need in this city right now. And I just want to start there, that I know how hard this year is for all of you, and I know that sometimes people position, because we get to sort of put those blinders on and simply focus on curbing transmission,
You're going a little in and out, just making you aware that your transmission's going a little in and out.
Uh-oh, okay.
Just
Sort of wave your hands.
the vocal is the only thing. Visually, you're not being frozen.
I'm even on a landline. Am I still going in and out?
Can you
Chelsea, you want to take over?
Oh, no, Jackie, please go ahead. We'll muddle through it. We really want to hear from you. Just making you aware.
Okay. The other thing is, let me just switch to, let's try this.
Just want to make sure we get to hear every word, if we can.
Can you hear me on the computer audio?
Yes.
Is that better?
Let's hope.
Okay, let's do that. I'm just going to hang up the phone.
Thank
you. All right, let's do computer audio. So, what I was saying was that I have a lot of empathy for small business owners right now, and I want to make sure you know that. Let's go ahead and pull up the presentation. Not sure, Chelsea, whoever's got that.
Jackie, I think you might have covered the speaker with your hands or a paper. Okay, let's. Can we hear music from someone somewhere?
All right, Jackie, you want? I'm driving. Go ahead and take it away when you're ready. Got it. I think Jackie might be having a little bit of tech issues, so I can kick it off. I think her framing was perfect. The reality is that New York is in a new moment right now. We need to drive our numbers down. We are seeing very concerning trends in our case rates and percent positivity. This is data that you can find on our website at nyc.gov/health. You can look up your own zip code, percent positivity, case rates, hospitalizations, etc., all for your area, and see in real time what's happening. I think the main message here, and this is how Jackie opened, is that driving these numbers down really is key to keeping New York City open.
Do you want us to see two screens at a time?
No, you should not be looking at my other screen. I'm sorry if you are.
Yeah, if it's possible. Sorry for the tech difficulties.
I'm so sorry, everyone. This is, let me try to reshare it.
Jackie, do you feel like you're back visually? Oh, no, she disappeared. Okay.
Is that better, or are you still seeing both screens?
Still seeing both screens, but just move ahead. It's fine.
I'm sorry. This is why we practiced, and it still is. I apologize.
We did practice.
I'm trying to see if I can fix it now. I'm so sorry, everyone. I don't want you to have to look at both.
Okay, go ahead.
Okay. So if anyone knows how to fix this, please feel free to chat me and I will address it. So this is a graph showing testing volume. I think that our key here is that we have the supply for testing. We want to help everyone access testing. This is our greatest asset here in New York City. We are in a different place than some other jurisdictions in the country when it comes to testing resources, but we want to know what you need. And it will be at the end of the presentation, but we have a website and text number so you can find for your free testing near you.
And one thing I want to add, Chelsea, if you stay on that slide, is that we might have heard a lot about test turnaround time, and we've worked really aggressively as a city to get that down to 2 or 3 days. Usually it takes 1 day. It can take up to 2. And so we really would love to get the word out that testing is a lot quicker and more reliable now.
Great. So I know we've been getting a lot of questions about what is causing this increase. I think previously we had a lot of, one-off big events, things that we could point to in very targeted areas of the city. We're in a different place now. We are definitely seeing community transmission. We know how COVID spreads. It spreads indoors, particularly without masks, gatherings indoors. We know there's real COVID fatigue in New York City right now. People are tired of this, and we understand, but now is not the time to let our guard down. We need to maintain vigilance and keep up what we know works. We'll get to that in a minute. You all have been great partners and really great at implementing all of the rules and regulations to try to prevent COVID-19 in your spaces, and we need to keep it up. I think we know that there is household spread, so we're seeing, within households spreading that way, and also travel to and from areas with higher COVID-19 transmission around the country. This is not a trend, unique to New York. We are seeing, obviously, COVID on the rise nationwide, worldwide, actually. But we are seeing fewer cases linked to travel now as transmission in the community in New York City spreads. We'll get to travel guidance in just a couple of moments, but there is new state guidance. We recommend not traveling, particularly for the holidays, but if you do, there are some pretty strict quarantine and testing requirements that you need to do if you do need to travel this holiday season. So this is just a little bit about our response. I'm trying to move through these quickly so that we can get to questions. I know that that's what you're all here for. This is what we've been doing. We've been working really hard over the last couple of months, over the last 9 months, really. And again, I just want to thank you all for your partnership, for those of you that we've worked with, and for everyone who's really been enduring this extremely hard time with the ever-changing rules and science. The ever-changing science is very real. So we've been working to issue guidance for you all with our agency partners to help you understand the state requirements and the latest public health guidance. We've been working on really scaling up our testing infrastructure as a city, as Masha was saying, reducing that turnaround time, increasing the access across the city, working on new test types, and then the school testing effort, of course. We have what we call hyperlocal responses. So when we're seeing, neighborhood by neighborhood increases across the city, deploying teams of actual boots on the ground people to go hand out palm cards and masks in those areas to do very targeted effort of education. This is where we were doing that citywide and continue to do so. Really just trying to get as much data out there as possible because we know that information short of a vaccine yet or any other type of intervention, medical intervention, information and testing, of course, is what we have. We want to give that to you and give it to you in a way that is easy to understand for the public. And then finally, this is the number for the Test and Trace Corps, this massive operation over which Jackie oversees. And this has been really quite the undertaking over the last year. It's been really maybe the biggest public health mobilization to date. And, you know, they work around the clock to ensure that New Yorkers are being traced when they, you know, have a case, and working to identify close contacts. We'll get into tracing in just a moment. I want to make sure that everyone really understands what happens when there's a case in New York City. We know it's really confusing. We just want to make sure that people understand it so that they get why it's so important for stopping the transmission. And then this is the number that you can call for a variety of services, take care services that kick in when you, and Masha, correct me if I'm saying anything wrong, when there is a case identified, the city wants you to have the resources that you need as you safely separate from others for your isolation period. So whether that's food or medication delivery or dog walking. And I think, Jackie, I know you just hopped back on. If you want to hop in for the contact numbers, that'd be awesome.
I'd be happy to.
Thanks, and cover anything I missed.
Okay, and let me, you know, Chelsea, jump back in if you lose me again.
I will.
So we are continuing to trace cases. We will continue to trace cases even as case counts rise. We're reaching about 90% of all of our cases, and we're completing intake and starting daily monitoring on about 75% of our cases, and we expect that to continue. You can go to the next slide. So here's how you can help. And usually when I start this presentation, I say I have really two messages, and they're the only two that matter. The first message I have for everyone is that this is a new phase of this outbreak, of this epidemic. We are not where we were in October. We are certainly not where we were in August. We had several months of low, you can jump back to the previous slide, sorry. We had several months of low transmission. We are more. We are seeing really widespread at this point community transmission. And then the second thing I always want to stress is that you are better messengers than we are. We know that trust in government is at an all-time low. And so we want you have the information you need to be messengers for us. People trust you. You are leaders in your community, and we need your help. In the next few days, here are the things you can do. You can tell your networks, your staff, your customers, fellow business leaders that you work with to do the following things. One, avoid travel and avoid the holidays. I know how hard this is. I had a darn hard time convincing my parents not to host Thanksgiving, but it's really important that we avoid travel and we avoid gatherings. One of the hardest things to wrap our brains around is that travel, when you're talking about a respiratory epidemic, the sort of the highest common denominator, and that can be really dangerous. Two, we need your help to encourage testing whether or not people feel sick. Right now, we're testing anywhere between 35 and 60,000 New Yorkers a day. I think Masha and Chelsea walked through these numbers, but test turnaround time is low in New York City right now. That's a real privilege we have. That's not true everywhere, but it is here. And we could be testing between 80,000 and 100,000 New Yorkers a day before our test turnaround time went up. We want to get more people tested. We need you to tell your staff and your community to seek testing, even if they don't feel sick, especially if they're interacting with the public. Three, we want to make sure that people understand that we are here to support them if they get COVID or if they've been exposed. We are seeing too many people go to work sick or go to work after COVID exposure. And I get why it's happening. I understand it. I have sympathy and empathy for people that need to hold on to their jobs. So we want to make sure that everyone knows how to access the services, the paid leave services, the food services, the financial services, the emotional support services that we have. Folks can call our Take Care team. You can call our COVID hotline and get connected to our Take Care team to help people figure out how to safely separate and isolate and quarantine. but it's really important that we stress the need to not go to work sick. And then finally, help us encourage, not just encourage folks, help us insist that all New Yorkers are wearing masks indoors and outdoors. If you have your aunt and uncle over to your house, or your parents, or that best friend you haven't seen in 8 months, first of all, not a great time to do that. But second of all, if that happens, we want you in masks, even if you're in your own home. If you're in a space with other people that live outside your home, we want you in masks. Here are things you can do between now and the holidays. You can make sure that your establishment is not hosting holiday parties. This is not the year for holiday gatherings. You can make sure that you're paid sick leave and staying home when people are sick, and you can encourage flu vaccination. This is the most important flu vaccination of our lifetimes. And obviously, we want you to continue to follow the New York State requirements. Here's the deal. It is legally required for all employers to report any employee to the health department who has COVID. We are going to keep that information confidential. I know that people get worried that if you report cases to us of your employees with COVID, that it might come out that you had a case at your establishment, and that might be bad for you. We're not going to release that information. And the way you know we're not going to release that information is that we haven't been releasing that information. We get over 100 facility reports a day, and we keep them confidential explicitly to encourage more people to report to us. And that's really critical. So if one of your employees, one of your patrons has COVID, but really one of your employees is what's required, we need you to call that into us. Next slide.
Really quick, Jackie, before we move on to the next slide in the guidance, do you want to do a quick overview of tracing and what happens when either the folks call the city or we get a report in?
Yeah, so here's what happens. So like, so if we get a facility, if we get a facility report, right? So someone, you call us and you say, one of my employees has COVID, they were at work yesterday, right? What we'll do is we'll check our record. Already know that, and we're piecing together where that person has been, where they've worked, where they've socialized, where they went to a house of worship. And what we'll do is we'll ask you to send us a list of people that could have been exposed while that employee was in your facility, right? So when we do tracing, we do it in two ways. The first thing is we're asking the case, we're asking the individual with COVID, who could you have exposed? Who were you in close contact with? But the second thing we're doing is we're asking them, where were you? And when we get a list of places where they were, we're going to call those facilities and we're going to say to those facilities, hey, you had someone that had COVID and they were in your facility on Tuesday from 5 p.m. to 10 p.m. And we need a list of other people that they could have come in close contact with. And then we're going to treat both of those groups of people as close contacts, and we're going to monitor them during their quarantine period, encourage them to get tested, help them safely separate from their loved ones, their household, as a way to break the chains of transmission.
And I think that that's a really great point, Jackie. Breaking the chains of transmission is the exact goal of contact tracing. It's not necessarily to find out exactly where you were infected. This virus doesn't work like that. It's about figuring out who you were in contact with so that we can ensure that they're safely separating before they potentially infect others. I think the other key thing here is, we hear words, especially in this space, in your world, like facility, investigation, and I think that triggers a different thought of like an inspection or the health department busting in and closing your doors. And that's not what's happening here. What's happening when there's a case is a very careful scientific investigation with the people to figure out where they were, who they were with, as culturally sensitive and careful as we can be with everyone's information, and very obviously private with everyone's information. with the goal of not penalizing anyone, but like Jackie was saying, breaking the chains of transmission, because this is the key. The faster that we get people safely separated from others, and that includes if they can't safely separate at home. That's what Jackie's team has set up with the hotel services and other services for New Yorkers who may not be able to separate from others while they're sick or potentially infectious. That's the key here. And the faster we do that, the faster they can get back to work, they can get well, and they cannot spread to others to potentially impact their community, families, and your business.
Yes, well said. Let's go to the next slide. This is our holiday guidance. It tries to both say what people shouldn't do and what people should do. We know that in a world of fatigue, we have to give people options, not just give people restrictions. But it is really important this holiday that we don't travel and that we don't gather outside of our immediate household. I think we should keep moving forward so we can get to questions. This is all on our website, and I believe we'll be sending all of this out. We'll be sending all of this out after this call. So do not travel over this holiday season. If you do have to travel, be prepared to quarantine. We are enforcing the travel quarantine here in New York City and New York State. It's an incredibly important part of how we're keeping people safe and how we are, attempting to suppress surge in virus transmission. And again, we'll send all of these flyers out. When to get tested. So when to get tested is an important conversation that we're all having. We want every New Yorker to get tested, regardless of whether you have symptoms. And then we want certain New Yorkers to get tested often, at least once a month. If you're a healthcare worker or a first responder, if you work or live in a residential congregate setting, like a nursing home, a shelter, drug rehab, if you're an essential worker with direct contact with others, and this one I think particularly important for all of you, if you work outside the home and you interact with people, I want you to get tested often. Testing is at no cost to you. It is widely accessible across the city, and it's safe. And now I think we get to take questions, which is always the best part.
Thank you, Jackie, so much, and also Chelsea. And I also forgot to mention Masha Gindler from Department of Health or Test and Trace. From Test and Trace.
We're one team.
One team.
One happy family.
Yes, and I'm
New
sorry.
City Health System.
Many apologies for the tech issues. Thank you to those who messaged me offline to figure it out. Thank you, Ariel, for your patience with us as well.
That's okay. No worries. I appreciate you all being here. And we're going to get to the Q&A now. I just want to preface by saying I understand that this is difficult information, especially for the businesses that make their living and contribute to the city by social gathering and creating social gathering. There is data and statistics around the city, around the country, around the world about the surge in cases that are happening now. It's undeniable. We have no choice but to acknowledge that we have to do our best through hopefully temporary restrictions to flatten the curve to prevent this spike from getting out of control. It is painful, it is complicated, it is difficult for all of us on an emotional, financial, social level. But the purpose of this call, the purpose of giving everyone this information is so that we can get real, get active, have a strategy, and squash this so we can keep moving. There is light at the end of the tunnel. We just have to, we are New York. We have the best resources. We have the best of everything. We have great testing now. There's vaccines coming. Let's just stay positive, stay strong. And I understand everyone's really angry and upset and confused, but these are the facts. And we just have to accept, what the data is showing and do our best. So with that, we will answer your questions now and try to get as much clarity as we can and then get to the guidance. Thank you again, Jackie. Jose, can you begin with answering some questions or asking questions?
Sure. We have a couple of questions regarding the process for what happens if an employee receives a positive test. Is that business required to shut down for a period of time or wait for a period of time before cleaning? And if that employee has been in contact with many other employees, does everybody need to stay home and shut down the business?
Great question. So the most important thing if an employee tests positive is that they need to stay home. That's by far the most important thing. They need to stay home. The business doesn't have to shut down. What we'll do is we'll interview that employee. And if we get the name of the business, which we should, because you should call us, we will also interview you, the business owner, and we'll decide between that employee's interview and the interview with the facility who could have been exposed. And we'll ask all of those people to quarantine. That might be your staff. It might be some of your staff, not all of your staff. It might be none of your staff. It really depends on what that employee was doing and who they came in close contact with. But we'll do those interviews. We'll provide a list for quarantine. We'll ask all of those people to stay home for 14 days. We'll encourage them all to get tested, but we do not shut you down. That is not the goal of any of our investigations. It's not what happens as a result of our investigations. People get asked to quarantine and told to isolate.
And I think really quickly, I'll just define close contact, just so folks understand what that means. When we say it, it's someone that you've been within 6 feet of for 10 minutes or more, cumulative. So over, I believe it's over a 24-hour period, Jackie. So that means if you were close to someone, masked or unmasked, doesn't matter, that is a close contact for you. So those are the types of questions, and it's why every investigation is different. There isn't one size fits all model here. It's totally dependent on what your setup is, how close were the people, for how long, with whom, and that differs every time.
Jose, I just want to interject one question that I've been hearing a lot in regards to when operators are trying to report that they're having some difficulty connecting with the right place or the right number and going through a little bit of a labyrinth of wait times and being redirected from city to state. So would you be able to maybe share that process and to make sure that people aren't going through that frustrating experience?
Yeah, and I'm sorry about that. That would frustrate me too. So there's 2 hotlines. I'm going to ask if the PAL hotline, which is, it's sort of, that's your, if you're an operator and what you're trying to do is report a case, this is the hotline to call. Chelsea, you want to give that?
That number, and I'll put it in the chat too, is 866-692-3641. And what will happen, just to set expectations, when you call that number, you'll talk to an operator. They may ask you some questions. They will likely take information from you, and then you will get a call back from an investigator who will be opening that case for your location.
Give that number one.
Yep, 866-692-3641. And that's for calling with a confirmed case. So not just, I think my neighbor has COVID, I'm not feeling well, I think I have COVID. This is so that you as a business owner can meet that obligation of having to report to the health department. This is the number that you call.
If you have other questions, or it's the I'm not feeling well, or I need help figuring out A, B, and C, or I'm looking for testing, then you call 212 COVID-19. So it's possible if you call 212 COVID-19, you're like having to get transferred, right? So, but if you have general questions, 212 COVID-19, if you're very specifically an operator trying to report an employee case, you want to call the number that Chelsea gave.
And I just put both of those in the chat.
Thank you.
Yep.
Okay, Jose, thank you.
Just a follow up to that, what is the timeline for considering an employee a close contact of someone that has tested positive? and how might that person be cleared?
So, we are completing investigations within 48 hours, generally. About over 80% of our investigations we're completing within 48 hours. If you, let's say I work with Chelsea, I test positive. Hi, Chelsea. I test positive, and I have no symptoms, and I've never had symptoms. Chelsea I would be considered infectious 48 hours prior to my test. So if I had been 2 days before, the 2 days before I got tested, then Chelsea would be a close contact. Again, if we had that within 6 feet for 10 or more cumulative minutes. If I have symptoms, then we're talking about 48 hours prior to the beginning of my symptoms, regardless of what day I got tested.
I also want to stress when we don't expect everyone to be epidemiologists. Not everyone intentionally went to school for this, and we understand that. I think that's the goal of Jackie's expert tracers, our health department tracing folks. We are here to kind of talk you through that and explain who needs to do what when. But like these basics are really important for everyone to understand. That I think at its core, if we're hearing one message from Jackie right now, it's if you test positive or if you're in contact with someone who has tested positive, separate immediately. So get yourself home.
We have several questions about testing in particular. Is there a way businesses can have access to regular testing for their employees or to coordinate self-testing? Or are there other places that we are specifically recommending folks get tested?
Sure. So the easiest way to get your employees tested right now is to send them to any of the city's locations. There's actually over 200 locations across the city offering no-cost testing. About 40 or 50 of them are run by the city themselves. I know folks are experiencing long lines at CityMD. If you go to an H&H facility, or one of the DOHMH facilities or our mobile units, there are really very short lines. So you can do that immediately. You can go to nyc.gov/COVID test. You can look up which are the city-run sites. There are very short lines at those sites, and you can send your employees there. If you want on-site testing, you can work with us to set up what we are calling a self-swab site. That's where we would train a couple of your employees. It's like a 90-minute training. We'd sign an agreement and we'd give you a stack of self-swab kits that employees could do. You'd sort of set up a folding table at your establishment or out in front of your establishment, and you'd become part of our testing team. You'd become part of our regime. And that is an option available to you. Those are not rapid tests. I saw someone ask for rapid tests. They're not rapid tests. They're the PCR tests. So they're gold standard test. They take about 48 hours to come back. But that we could give you and we could work together on. And so we will, when we do a follow-up email, send the link to tell us that you want to become a self-swab site. So that's an option available to establishments that want to do that. But if tested regularly immediately without setting anything up at your establishment, you can absolutely send folks to the existing sites.
And H&H is for health and hospitals.
Yes, sorry. Thank you. Health and hospitals is the public hospital system in the city.
Yeah, there's tons of them. If you just Google health and hospital COVID testing, you'll get all the sites, their hours, and all the other directions you need.
And I just put the testing site locations in the chat. I also said you can text COVID test as well to help find a site near you.
That's true. But we would have, we would be happy to work with you to become testing locations with this new self-swab sort of do-it-yourself model if you're interested. And we'll send around a link to fill out a short survey if you are interested so that we can follow up.
And we'll just do a few more questions regarding test and trace, and then we will go into guidelines, but we will still have Masha and Chelsea able to answer test and trace questions in the Q&A. So we can continue with that as well, just to make sure we get it all in. Thank you. Jose?
A couple of questions we're seeing about, does reporting an employee's COVID positive result expose that employer to possible Hipaa violations?
No, not at all. The way that the law works around infectious disease reporting is very different than people's sort of popular sense of Hipaa, because that there is a it not only does it not expose you to any like doing anything unlawful, that you are legally required to report it.
Okay, seeing a couple questions also. Are there recommendations for businesses that might want to do rapid testing of guests at the front door?
So here, the challenge, I mean, I'm thinking, hold on. I think rapid testing is absolutely going to become an ever increasing important part of the response. That said, to do rapid testing right now, appropriate medical and clinical certifications, it's called a CLIA waiver and a CLEP permit. Maybe I got those backwards. So thinking that, oh, I can just get rapid testing at my establishment, you're going to have more luck getting the sort of self-swab at your establishment if you want to do it at your establishment. If you're a really large employer or a really large building and you want a medical provider that has the lab certifications, we'd be absolutely happy to talk to you about that. But these are not tests. The rapid tests are not tests that laymen can perform. The self-swab tests are tests that non-clinical staff can perform.
If an employee tests positive and team members that were in close contact with that employee have been asked to quarantine, if those employees get a PCR test 5 days after exposure, those tests are negative, can they return to work before the recommended 14 days?
You cannot test out of quarantine when you've had an actual exposure to COVID. I want to explain what's in that question because it's a very smart question. Let's say I get exposed to COVID on the 1st of December. It can take up to 14 days for that virus to show on a test. So I might test negative. I test every single day. I might test negative on December 2nd through 13th, and then December 14th positive. Now, it's true, the vast majority of people who have an exposure and then develop COVID due to that exposure are going to test positive, sometime between the 4th and 7th day. There are people after having tested negative due to that initial exposure up to 14 days. That's why the quarantine period, 14 days, it's also why you cannot test out of quarantine. So we think getting tested is important because if you are a close contact of someone and you test positive, then I figure out who else you could have infected, who else you could have exposed. So again, we stop that chain of transmission, but it doesn't help you test out of quarantine. There is no testing out of quarantine. There are special rules for the travel quarantine, because in the travel quarantine, you're not actually definitely exposed. You're coming from a high risk setting, but you're not yourself. That's really different than a confirmed exposure and how we treat quarantine.
I have one question actually. Are you legally obligated or is it illegal to mandate that your employees take tests? Like if you want your employees to take a test, can you force them? I guess to say it in a more layman's way.
don't recommend mandatory testing. And I would want a lawyer to answer, although Chelsea, you might know, you do more enforcement than I do. I want to get back to you on whether or not you're legally required to mandate tests. You're allowed to legally require mandated testing. I want to get back to you on that. But we don't recommend mandatory or compulsory testing.
Okay.
Yeah, I was gonna echo Jackie that we can get back on whether you are able to require as the employer. There were several sectors under New York Forward reopening that did have a testing requirement. Personal care services and barbershops, I believe, were two of those. And this sector is not one of those that does require regular testing of staff. But we can get back to you after speaking with our legal colleagues on your real question.
And I would say, if you're running a nursing home, right? If you're running a high risk setting, real reasons to insist on testing, but you wanna, this is about a risk analysis usually, right?
Okay, thank you. Jose, let's do one more question and then we will shift gears around test and trace. Thank you, Jen.
Okay, I'm going to ask two very quick ones.
Okay, two.
What can a business tell its employees who might be afraid of visiting a testing site for fear of contamination or ID verification? And real quick, if an employee has tested positive, may the business owner release that employee's name to their coworkers?
Oh, great questions. Okay, so here's the testing sites are really safe. Can you hear me? Are we good?
Yeah,
Okay.
it dropped for a second.
Okay, our testing sites are really safe. We do tracing all the time, and we don't trace infections back to our testing sites. They're run by professionals. People are kept distance. People are kept in masks. Many of the lines are outside. Is a safe thing to do. If you have employees, but the test sites are safe. The second thing is we don't collect documentation status. If folks are documented, we don't have status. You don't have to be documented to seek a free test site. You don't have to have insurance. If you have insurance, bring your card, we'll bill it. Bill your insurance, not you. Expand the resource pool. But we never give out documentation status. We're not legally allowed to give it out, and as a policy matter, we never would. So that's the answer to the first question. And now I'm blanking on the second question. Masha or Chelsea, help me out here.
I think
It was a good one.
One was about immigration status, and the other one is, are they safe? Right.
And the other question was, can a business owner inform employees
Oh,
of
no.
the name of,
Great question. No, a business owner can inform us and must inform us. You should not release the information to the rest of your employees. We will tell the other employees who needs to quarantine. We will do that without telling them who tested positive. That's really, it's an important question. You should not release that information to the rest of your employees. You should call us and tell us and let us handle the follow-up.
Perfect. Actually, Chelsea, could you or one of you mention about what is NYC Care, the healthcare system that provides free health regardless of immigration and financial status? I think it would be whoever can speak best to that.
You want me to take it, Jackie?
Yeah, please.
I'm also trying to find, as I'm multitasking, drop both the link and the phone number for NYC Care. So yes, just as Ariel was saying, it's a healthcare access program that we have set up here in the city. It guarantees low cost or no cost care and services to New Yorkers who may not qualify or can't afford health insurance. So all of this is through NYC Health and Hospitals, the city's public hospital system that you've heard mentioned a couple of times. times. You get a membership card, you get access to healthcare services. Highly recommend if you have folks who may fall into any of these categories, or if you yourself do. I have many friends who are part of NYC Care and have really had a great experience getting healthcare for the first time in a long time, where they may not have been able to before. So I'm dropping the link for that and a phone number that is 646 NYC Care.
Thank you so much, Chelsea. This is something we also encourage all the operators to share with their employees, that regardless of immigration status and income, that they do have access to free, not just physical, but mental health care to help address a lot of the real emotional and psychological stressors that we're all going through. So Jackie, Bray, thank you so much for coming, and I hope that this has been helpful for everyone, and we will continue again to have Chelsea and Masha in the chat to be able to answer questions. And we appreciate very much for coming and giving us the facts of the situation. Thank you.
Thank you. Thanks, everybody.
We're going to pivot now quickly to a brief presentation, or just a brief presentation from DOT about the new winterization, but then we will pivot quickly, no more than 5 minutes, so that we can have a good half hour for questions and answers.
All right, thanks, Ariel, and thank you to all who are here today. My name is Julie Shipper. I'm the Deputy Chief of Staff here at New York City DOT. I'm here today with my colleague Judy Chang, and we're hoping we can answer all of your questions. We know there's lots of them, so we're going to get quickly to that. Just a few notes on the open restaurants program. Now that it's been made permanent, we're finding it very important that we make sure all the roadway seating areas are as safe as possible year-round. Especially with all of us going into the winter months, with snowfall, potentially collapsing coverings or barriers, slippery roads, and poor visibility. We just want to ensure that everyone is being as safe as possible. Last week, you should have all received an email explaining our new robust safety guidance on barriers, enclosures, and expectations during snowfall for the winter time. We can go into more of the actual restrictions and guidance through the chat and through questions. But we just a few points to mention quickly. In the email, some of the safety enhancements will be made mandatory. So the city, in order to help restaurants, will be providing sandbags, reflector tape, snow sticks, and plastic barriers, all for pickup for free of charge for participants. In the next week or so, more information will be provided on exactly where you can pick it up. And so you'll be receiving that, and stay tuned. Lastly, for restaurants that are in areas that are really high priority locations, like high traffic, high crash locations, the city will be delivering plastic barriers to you. Again, more information on that will be coming as well. And those specific restaurants in those areas will be contacted separately. I want to turn it back over to Ariel and Jose to start the Q&A, but Judy and I are both here, as well as other city agency partners, to help answer your questions.
Thank you so much, Julie. Okay, Jose, let's dig in. I know that this is a really frustrating experience for everyone, but hopefully with the clarity of these guidelines, it will help to lessen the stress that everyone's going through.
All right, this is a question for colleagues at DOB. How can a business calculate 25% capacity for an outdoor dining space if that space does not have a certificate of occupancy?
Hi, good afternoon. This is David Lewis from the Department of Buildings. So if you don't have a certificate of occupancy, you're going to have to calculate square footage. And I'll also share this information in the chat as well. So this way it's easy to review. Oh, I just see that Christian just uploaded it, so thank you. But you would have to calculate the total floor area of the restaurant minus if you've got a bar area. and then you divide that by 15 square feet. So that's the total area allowed per person. And then you round that to the nearest number, giving you the total number of occupants allowed in the building.
Thank you.
A related question, how is the city recognizing the difference between indoor and outdoor dining for businesses that are making outdoor dining enclosures?
So I can take this one, and then if there's more information from DOB, feel free. In an outdoor dining enclosure, if there's more than 2 sides, so 3 or more sides, we're considering that indoor, and that should be at 25% capacity seating. If your enclosure has only 2 sides, you can consider that outdoor and follow the outdoor guidelines there.
Okay. For the gathering limit of 10 people, does this apply to private events as well, or can private event spaces book private parties with socially distanced tables?
Jose, it's Christian. I answered that one in the Q&A.
You could answer it again.
We're asking some that have been answered in the Q&A that might be relevant too.
Oh, okay. Boy, let me summarize. Hopefully I don't contradict what I just wrote. You know, without an address, it's hard to say exactly, nor is this event meant to do address by address guidance. And forgive me, everybody, for not being on video. I've got some household bandwidth problems and I'm trying to avoid cutting in and out. If you're having a private event in a restaurant, you've got to check, you have to check 3 places, right? You have to see whether or not you're in a microcluster and figure out what the guidance for the microcluster means for you. If you're not in a microcluster, then you're just defaulting to the other 2. You have to comply with both the indoor dining and you have to comply with the relevant limitation on gatherings. So for example, if you're not in a zone and the limit on a gathering is 50, then you then have to compare that to what your indoor dining capacity can be. And it's going to be whatever is the most restrictive number is how you do. So, you know, apologies that can be challenging to check those places, but that is what's required, right? And then obviously if you're in a zone that limits the number of people you can have in a gathering, chances are it has already restricted your indoor dining considerably as well. But you need to check those 3, the micro cluster guidance, the indoor dining guidance, and the overall limitation on gatherings that's applicable no matter what the industry is. And you have to follow the most restrictive for the number. You also have to make sure that that it's distanced, it follows the limitation on number of people at a table. So if you could have 50 and the limitation is 10 per table, then you've got to make sure that you're not having tables that exceed those capacities.
Thank you, Christian.
Seeing a question about, are there any specific guidelines related to the construction of semi or fully enclosed structures on the sidewalk? So this is about structures on the sidewalk as opposed to the roadway.
At this time, we're not allowing enclosed structures on the sidewalk, just in the roadway.
Okay, this is a question regarding snow conditions. Do structures have to be removed when there is 12 inches of snow? And who is going to let businesses know that these structures need to come down and when they may be built back up?
So, you know, one of the reasons why these structures can't be, you know, enclosed and they can't be full structures, that they have to be able to be moved, particularly when there's inclement weather. And so during that time, those structures would have to be out of the way so that plowing can take place and shoveling. There isn't a notification citywide that will be going out to business owners specifically, but you would know, just through the normal news channels that, it's a snow day or, expect shoveling to take place. So you would proceed with caution. If you are putting your structure out, just understand when it's happening, when the sanitation trucks are passing through your community. So this way, your business is not impacted with having to move a structure in between, your normal operating hours.
And additionally, you can sign up for snow-related alerts through and Notify NYC by either calling 311, nyc.gov, or following Notify NYC on Twitter.
Would it not be also perhaps on sanitation or where do the weather alerts come from? Also, if you sign up for DOT, right, the alerts come like on your Twitter as well?
The Department of Sanitation does issue weather alerts. So we're referring to the weather alerts, but also DOT already does post on social media and sends courtesy emails to participants, many of whom on this town call should have seen them already. Even for high wind events, when we advise, we don't require, but we advise that you close up your umbrellas and tents and stuff like that so they don't fly away.
So just to clarify, you don't have to remove your whole structure. You can't necessarily be using the structure, right? And just to clarify that point, David?
So it's possible you may have to move it, but you don't also. So it also depends, right? So if you're getting heavy snow and you've got a concern about the top of the structure having a lot of snow on it, then it'd be prudent to remove it until either the inclement weather passes on, or if it's on the side and the structure is near this completely near the sidewalk and there's like snow mounting up. Can't speak. You would have to then move that aside so that while sanitation is passing through with their plowing, it doesn't push more snow onto the structure. And, I know I'm the representative to talk, on behalf of DOB, but Joe, if you've got anything that you want to chime in about the structures, feel free.
Sure. I know that at this time, we don't have guidance to share on more permanent structures, and that guidance is going to hopefully come soon. So obviously with more permanent structures, removing them in advance of a snow event is going to be more difficult. So that guidance is coming soon, and we hope to be able to share that soon. But I think David is speaking to tents and things like that are relatively easy to take down in the event of a storm.
I also would just add, we all know like the workers in the bar and restaurant industry often have the responsibility of keeping their sidewalks clear and put the salt down and shoveling. And so I think also the bids, if you are in an area that has a local bid, a lot of efforts are going to be made on a local level to supplement the snow removal. Obviously, these big trucks that are going through and plowing through do push the snow, but I think it would be, a sort of obvious choice to also be prepared as operators to have shovels and salt in order to really keep and maintain your area in addition to the city efforts in order to help avoid some of the potential problems that might come with snow accumulation. Jose?
This is for DOB and DOT. What are the restrictions on running extension cords to the street for heaters and lighting? Can they run overhead to avoid being on the sidewalk?
So there is particular guidance for running cords, and I'll make sure to include that in the chat as well. As far as electrical heating goes, it could be used under the tents, but the temporary cords that are being used through the building they must be weatherproof, and they can't run across bike lanes. I believe another question was about overhead for a different kind of heating. Do you know what that question was? Can you repeat it again, please?
The yeah, can the cords run overhead to avoid being run on the sidewalk?
Yes, so some cords can be run overhead. What I'm going to do is I'm going to post the guidance right into the chat, but you'd have to pay attention specifically to what kind of cords and which kind of heating that you're using. And while you're making those connections, I would just encourage everyone to ensure that you speak with a licensed electrician or a licensed plumber, depending on the kind of heating that you're connecting, to ensure that you're doing this safely, particularly when we're speaking about electrical connections. You want to make sure that adding an additional heater or heaters to the interior of your outlets can handle that load. So just to be on the safe side, and it's actually required that you just speak to an electrician, have them check it out to make sure that you're all set to make certain connections.
Are there specific guidelines for the use of materials for outdoor enclosures and structures? Someone's asking about plastic windows versus real windows or plexiglass. So the question is, do we have material specific guidelines for outdoor structures?
So DOB does not have any guidance on specific materials that should be used. But again, as we've discussed, the structure shouldn't be permanent structures, right? And so you've got to make sure that that the materials that you're using, as far as permanent windows, that should be something that should be installing onto a structure. But again, we don't have guidance yet, and once that comes out, we'll be able to issue it. I do see that the Office of Nightlife had put in the buildings bulletin, so thank you for that. So.
And just a bit more on the barriers, we are requiring them to be 18 inches road barriers and completely filled with soil, sand, or another similar material in order to keep those structures really secure and robust.
Another question related to power. Are businesses allowed to use generators on the sidewalk to power heaters on the street?
I guess that would be FDNY perhaps?
FDNY or DOB. I think FDNY can follow up here, but our guidance is specific to hardwired or extension cord powered electric heaters or natural gas heaters, or FDNY has more specifics on propane related heaters. We don't have guidance on the use of generators to power electric heaters.
And from the fire department, in order for the generators to be used, they would have to file a variance for it. So they would have to have an approval from the fire department. So they're not going to be allowed to use as of right. So would have to go through technology management to file for approval.
So it is possible if you get a permit to do so? Is that the conclusion there?
It is possible. However, typically we would allow to use generators on a street fairs when a street is closed. Unfortunately, I mean, if the sidewalk is not closed, most likely we will not allow that to happen. So we would have to go case by case scenario. I mean, if you are on a parking lot, it's a possibility. If you are on the sidewalk, I'm not sure that's going to happen.
Or a closed street, it's possible, perhaps on a case per case basis.
It's going to be case by case scenario. That's correct.
Okay, thank you so much. Jose?
Yeah, I'm seeing a few more questions asking for further clarification on what constitutes an outdoor dining for a partially enclosed structure. Questions about can you have 3 sides versus 2 sides? And at what point do you need to be considered indoor dining at 25% capacity? Just a little bit more clarification on that, please.
So we're considering enclosed structures with 3 or more sides to be indoor. So those structures would need to be at 25% capacity. If you have 2 sides open, so 50% of your structure is open, then we can consider that outdoor, and you can continue to sit in that way.
Julie, I have
Julie, if
oh, sorry.
just to try and clarify,
Yeah.
if the 50% of the open sides is made up of a sort of combination of partial openings in other walls, would that count towards the 50%, or does it have to be 2 fully open sides minimum? In other words, if the long side facing the building was fully open, and then part of the roadway facing long side was open, and the combination of those 2 openings equaled 50% of the total, would that count?
We need to get more clarification on that. So we'll clarify and send out more guidance on that specifically.
Because there's a lot of creativity out there in the way that people are building their structures. And so it might be not one long side and one short side open, but maybe half open or half closed all the way around and open on the top, so that there is a cross ventilation, which I think is the primary purpose, is to have that ventilation. And so being able to calculate different ways of measuring 50% opening, not just by sides, but maybe if each side is half open and equals that amount, I think would provide some room for creativity and also address some of the issues. Roseanne, did you have something to add?
Yeah, something on the latest guidance says that one of the sides has to be facing the roadway. So it seems like that has to be
one of the sides that are open.
Yeah, it says of the 2 sides that need to be open, one must be parallel to the roadway.
So behind you? Again, so I think, for example, if we're trying to achieve both safety and warmth and protection, I guess that's 3 things, is it feasible to have it halfway up so that it's blocking the wind where people are seated but open above?
Yeah, I understand the question. We need more guidance from City Hall, so we'll go. We'll try and get that guidance and bring it back to you and distribute that way.
Okay, we'll send that along with, we will copy and paste all of the links that are going into the chat and into the Q&A and be able to return that in a follow-up email. And then if there's additional guidance that comes out afterward, we will include that in the follow-up email. Thank you, Julie. And Andrew. Jose?
We have a few questions from folks with private outdoor space, either patios or rooftops, wondering what these rules pertaining to enclosures, do they apply to them? So
yes,
this is for DOB. Yes.
Well, and this is Christian from OSC. I mean, I can say that part of, I think, maybe where some of the confusion comes in is that for the most part, a lot of the outdoor dining has been part of DOT's open restaurant or open streets process, right? But the state rules on outdoor dining allowed outdoor dining, when they allowed outdoor dining to resume, said that you couldn't have a roof unless it was open on 2 sides, right? And so I think that actually, those guidelines do partially answer this question about, can we be creative? They're very clear, it says open on 2 sides. And we have heard from the state that partially open, such as a door in a wall that is otherwise made of glass or something, did not count. If it's an outdoor space that's not part of DOT's program, then you're just referring to the state guidelines, and you have to follow the state guidelines for what those structures allow.
Stephen, do we have a link to that we can, or Roseanne, to drop into the chat?
It's in the chat already, and I just want to remind people that anything over 400 square feet requires a permit from DOB.
But the state guidelines for outdoor dining is also in the chat to be able, if you're on private property, you're not part of the DOT outdoor dining program, and therefore whatever the most recent guidelines are would not necessarily apply. You would go directly to the state for your guidelines, I think is.
Right. We'll look for that and try and get it in.
Jose?
Oh, we have one that's been answered in the Q&A already, but I've seen it come up a couple more times. What are the rules for outdoor dining pods or bubbles for individual parties?
We're going off of the same guidance that the state is given. So that's considered indoor, and you'd have to be at 25% capacity of the square footage.
So it would have to be 25% of the square footage in the bubble, and also have, what is the ventilation guideline on that?
If it's indoor, it can have if you're going indoor, it's the capacity is the guidance that we're giving. So the 25% capacity.
Okay, thank you for that.
Shifting gears, we have a question regarding, are there resources available for negotiating rent reduction or renegotiation with your landlords?
So I will take this question. Actually, both Stephen and I can take this question in regards to rent, commercial rent services and negotiations. I'll start off by saying that the Office of Nightlife, in partnership with the Center for Creative Conflict Resolution, partnered a couple of months ago to launch a new program called MEND, M-E-N-D, NYC. Originally, it was devoted to help all the commercial venues and in hospitality to resolve their issues, their quality of life issues with residents, and to address the high volume of 311 calls, especially now when a lot of businesses are operating outside. That service, that free mediation service to help resolve those issues with your neighbors, still exists through MEND. But we have also expanded that program recently to include free mediation between your landlords and commercial tenants. So if you are not communicating with your landlord, if you feel like maybe it's just a standstill because nobody wants to spend all the money on lawyers to get to a preliminary compromise and understanding about what the issues are and what some of the solutions might be in regards to rent renegotiation or lease renegotiation, MEND NYC is an option for you to get free mediation with your landlord and to start the conversation and to create a working document in order to be able to go to your attorneys at that point and to start the conversation again. And perhaps Kevin or Francesca will put a link into the MEND NYC website. And again, you can use that also if you're having issues with your neighbors and a lot of 311 calls and complaints and you want to resolve it outside of the 311 system. Stephen, can you talk a little bit more about SBS services regarding commercial rent?
Sure. The first thing I would definitely recommend is if anybody has a question or is looking for resources or support for negotiations with their landlord, I would recommend starting out with the SBS Business Hotline. Number is 888-SBS-4NYC. We'll drop that in the chat as well. You can speak to anybody who answers that hotline about what we have available for you for support. SBS also has a commercial lease assistance program that is, I need to double check. I think we are getting that. It's been on hiatus for a bit because of funding, but I believe funding has come through and we are moving forward. I don't know if they're accepting new cases, but we can certainly get more information for you. But they will have the answer for that on the hotline as well.
Thank you, Stephen.
Ariel, this is Christian from OC. Can I jump in and say something that I think addresses a few questions?
Yes, please. We have about 6 minutes, so everyone can chime in.
Sure. There's a few questions that say, I am this thing, but I don't fit into this category, or can I do this thing that isn't really covered in the guidance? Like I think someone asked if they are a private event space, they're not a bar and restaurant, what do they do? Someone asked about, what kinds of things are allowed in their otherwise outdoor dining establishment. And certainly through our enforcement, we've seen a lot of locations that are allowed to reopen in a limited way. So let me just say this. And also there was a question about, can I use my space for a different thing? No matter what it is that you're doing, there are guidelines that apply and regulate the activity. And I think, one of the challenges that we understand a lot of business owners are going through is that sometimes there are more than one set of guidance. So if you have a space where you are allowed to do different kinds of things, say an event space, the thing that you are choosing to do is the thing you need to check the guidelines for. If you're an event space and you decide to host an indoor dining gathering, right, then you need to be in compliance with the rules on gatherings, and you need to be in compliance with the indoor dining. If you were going to rent that same event space out for a concert, that would likely be prohibited as indoor entertainment, right? So you have to query for yourself, what is the thing I want to do, and then check the guidelines for that. You can use the business lookup tool, or you can scroll through the different sets of guidance to see. An example of that we've seen are, for example, a comedy club is allowed to open for indoor dining, isn't allowed to have the live performance right now. And so you just really need to pay attention. I will also caution business owners that, what we're saying is or isn't allowed in the context of COVID does not mean that you can simply change what it is that you're doing regardless of any other restrictions. If you want to change the nature of your business, that could implicate your lease, it could implicate zoning, it could implicate what the allowed use of a building is. And so you need to be very careful. I understand that businesses are looking for ways to stay open, looking for ways to pay the rent. I think those are the questions. Maybe one of the DOB folks could chime in with just a quick resource on how to check what is a lawful use of a building. But I hope that answers a number of questions, right? It isn't as simple as this guidance doesn't say I can't do it. That doesn't mean that there isn't another guidance that will say that you can, depending on what it is you want to do. I wish that I could give a more specific answer, but I just wanted to give that sort of general approach to everybody as they're considering how to pivot to stay in business.
Thank you, Christian. I mean, we definitely are getting a lot of inquiries regularly about events or private dinners in event spaces that are not bars and restaurants. And I think what Christian is saying is correct in the sense that there are guidelines for the activity. So if you're seated, if you're having a dinner party, you can't promote it or sell tickets for it per se, but it has to be seated, it has to be socially distanced. You can invite people to come. So there are guidelines around the activity that can help to provide clarity for the type of activities you're trying to organize in a social way. And I know the earlier guidance from Department of Health and, especially around the holidays is to not gather, restrict gathering. everyone on this call, for the most part, is in the business of social gathering. And so as we're heading into the holiday season, it's important to sort of recognize how can we help to keep the businesses, your businesses, open, operating, doing business, and having people dine and celebrate, but in the most safest ways possible in order to stop the surge and spread of the virus. And so I would just say all of you are the most creative thinking people in the city. And being able to create sort of packages around delivery for doing holidays at home, around packages of your meals and so forth, to really continue to just think creatively and continue to focus on how we can stop this spread so that we can return back to our regular way of doing business and life as soon as possible. I don't know if Stephen wants to chime in, or Jose, do you have another question?
Yeah, I'd like to take as much time as we can to answer questions, because that's
Okay.
what we are primarily here for, yeah.
Do you have one more question, Jose? Otherwise, we can maybe go to Chelsea for some final tips on how to proceed in a safe and healthy way. Jose? You're muted.
Sorry about that. I'm seeing a couple more questions about where folks can expect to go for materials in the roadway, like barriers, snow sticks, reflective tape.
It's a good question. When we gave out sandbags last time, we had it at a number of different DOT facilities throughout all the 5 boroughs. We will be putting out more information on this like in the next few days. So stay tuned for that. We do not have the location set yet or the timing of that, but it's coming very soon.
We'll make sure to have it in the follow-up.
Yeah, that would be great.
Unless
One other,
yes.
yeah, sorry, one other question that I've seen a couple of times, and I'm sorry if someone already answered it and I missed it, but are businesses that do not operate with an SLA liquor license also required to shut down indoor service at 10 p.m.?
Do you have the answer for that?
You mean me that just asked the question? No,
Yeah.
I'd actually like confirmation on that. I think I know the answer, but I'd prefer to hear from someone that actually knows for sure.
Jose, I think we read something about that. Who would be the right person? Jose, are you frozen? I can't tell. He might be frozen.
He might be frozen. All right. If no one has the answer here, we'll get the answer and we will send that out in the follow-up email, because I have seen it a couple of times in the chat.
Jose, are you back? Can you hear me? Unmute yourself. Okay. Did you, maybe Kevin also, there might have been guidance regarding businesses that do not have an SLA license if these restrictions apply.
I think we'll have to check on the specific nature of the business, but the 10 p.m. restrictions do apply to other indoor activities, such as gyms. Gyms typically do not have an SLA license. So we can follow up with that person directly, but I think we can presume the answer is yes.
Okay. We are 3 minutes over. I would just throw it to Chelsea and for any final thoughts.
Sure. Thank you so much. And thank you everyone for listening today, and again, being really great actors and leaders and partners in helping us control the spread. I guess my parting ask is that you continue to do what you've been doing and following all the rules, but also, as Jackie was saying, you're trusted leaders and voices in your communities folks listen to you. They understand what this all means to you, to not be able to run your businesses as usual. And so we really need all New Yorkers, your patrons, your friends, your families, and all of us to continue the core four, sticking to the four things we know works, which are staying home if you're sick, washing your hands, keeping 6 feet of distance, and wearing face coverings. We need everyone to keep getting tested, to avoid gatherings, particularly indoor gatherings, and for the holidays, really, you know, it's awful. It's been a terrible year, but we have to make the holidays different this year. They can't look the same. We can't travel, and we really can't gather in groups outside of our households if we want to keep this thing under control. You know, I'll end on one note. We've already heard, and we know that you all are leaders in the innovative creativity space of figuring out how to move your business models online, and into other formats that work, that aren't the norm. This is the new normal right now, unfortunately, and we just want to, you know, commend you all on your creativity here, out of necessity. But if you have ideas for how to have holidays while still maintaining community, but being safe, we'd love to hear them. We'd love for you to share them with your neighbors and friends, because that's what we need to do this year to keep New Yorkers safe, healthy, and maintain what we can to keep New York open. So we really appreciate you. Thank you. Stay safe, stay healthy, everyone. Thank you for the time today. Thank you, Ariel.
Thank you, Chelsea, and to everyone from all of the agencies that participated today. I do hope that the new format of having your questions answered in the Q&A as well as live was helpful. And I also just want to recognize, I know this is incredibly difficult information, and it's really what none of us want to hear, but it is what is happening. And it is for now. It is not forever. We are getting through this. We are moving through this. There is light at the end of this tunnel. We do have new vaccine information, better test and trace, lots of changes on the horizon. This will be a difficult winter, but we will get through it if we just stick to the facts and to the guidelines. And if things don't make sense or don't seem fair or right, then I please encourage everyone to continue to amplify that and share that with the Office of Nightlife, because we can then share it into where these decisions are being made. And this office and these agencies are stronger and work better when we hear from you about what you're going through and what you need. So I just encourage everybody to stay strong and stay optimistic. And we recognize that this is incredibly challenging, but just know that this is for now, not forever, and we will be back. And I wish you all the best today and every day, and we will be in touch with each other. And I'm wishing you all well. Thank you so much.